Hi, let's talk about the laryngeal cartilages. As you recall, the larynx is comprised of several laryngeal cartilages, the principal among them being the thyroid, the cricoid, the epiglottic, the arytenoid, the corniculate, and the cuneiform. Let's take a look at some of these. So from an anterior view, we can see quite a robust thyroid cartilage here. The thyroid cartilage is most robust anteriorly, and it's comprised of two plates or laminae that meet along the midline. And it's along that midline that we can see the rather robust laryngeal prominence of the thyroid cartilage. In profile, we get a better sense for the greater and the lesser horns of the thyroid cartilage. And it's those lesser horns that comprise the cricothyroid joint with the cricoid cartilage. The cricoid cartilage, let me erase this, sits inferior to the thyroid cartilage, and it is complete 360 degrees around the larynx. We can see a little bit of the cricoid cartilage there, and we can kind of imagine it there. Here we can see the cricothyroid muscles that are going to operate that cricothyroid joint. When they contract, the cricoid muscle tips anteriorly and inferiorly, putting tension on the vocal folds so as to raise pitch. From the posterior, we can see no thyroid cartilage in the rear. There are elements of the thyroid cartilage laterally here, but they're rather obscured by the musculature here. We can see the leaf portion of the epiglottic cartilage. That's going to come down to a stem, which will articulate with the thyroid cartilage. We can see the cricoid lamina. So here's the cricoid cartilage. It's taller posteriorly, and it's upon this lamina that the arytenoid cartilages sit. And they're going to be just posterior, or I'm sorry, deep to these arytenoid muscles here. So we can also see the interarytenoid notch between the arytenoid cartilages. We can see where the corniculate cartilages would sit atop the arytenoid cartilages. And we can see those airy epiglottic folds in which the cuneiform cartilages may be found. Thank you very much for your time.